Turning now to your community focus, 'tis the season to wash your hands as we deal with the cold and flu and norovirus.
And joining us to talk about all things health related is Dr. Philip Chan from the Rhode Island Department of Health. Thanks for being here.
Thanks for having me.
So in commercial break, we were just talking about norovirus. Anyone who's had it or whose kids have had it knows it is no fun. What are you seeing in terms of where it's cropping up, how much is cropping up, and what can people do to protect themselves?
So norovirus certainly is not fun. It generally causes diarrhea and vomiting for a short period of time. Very infectious. We tend to see it in kids in schools, daycares, day camps, etc. For outbreaks, and we're seeing those at this time of year, which is expected.
And what's the best way for people to protect themselves and their kids?
Wash your hands, wash your hands. Some of the same things we've been preaching about COVID-19. And just a reminder too for folks to stay home if you're sick. Keep your kids home if they're sick for at least 24 hours until it passes.
Now, Dr. Chan, we also understand there's another type of infection on the rise, STIs. What exactly are we seeing there?
Yeah, so STIs, sexually transmitted diseases, things like syphilis and gonorrhea and chlamydia. We've been seeing a spike over the last decade, and I think it's due to a lot of reasons, less condom use, more partners perhaps, but they've been spiking. And I think this has been one thing that's been overlooked during the pandemic. So just recommending to folks to check in with your primary care doctor about potentially getting tested for STIs. Everyone should be tested for HIV at least once in their lifetime, and especially younger sexually active people need to be tested for gonorrhea, syphilis, and chlamydia.
We also have been talking a lot about this bitter cold that we've been seeing, that we're dealing with today and tomorrow. I know you spoke with one of our reporters yesterday about this, but what should folks at home know if they're planning to spend really any time outside?
So this sort of cold can be an emergency, right? So hypothermia, when your body is literally shutting down because of it being so cold out, people should be aware of the signs and symptoms. So uncontrolled shivering, memory loss, changes in your cognition. So if that starts to happen, people need to immediately seek medical attention.
I wanted to ask you, President Biden has announced that he plans to end the COVID public health emergency that we've been living under for about 3 years now. What impact is that going to have on people in terms of access to vaccines and testing?
So it should not have too much of an impact on access. The good news is a lot of this stuff is already integrated into our clinical system. There should be little changes to treatment, vaccination, and testing. These public health emergencies allow the federal government to have more access to resources to address. There may be some changes with the way insurers address this, or maybe more out-of-pocket costs. That's something to be aware of. Hopefully the insurers will continue to cover them with minimal out-of-pocket costs.
Does this mean that COVID is over?
Well, I think it's a sign we're getting back to normal to some extent.
That is certainly good news. All right, Dr. Philip Chan with the Rhode Island Department of Health, thanks so much for being here.
Thank you for having me.